let me start by saying that AMR is a wicked problem. It is caused by the inappropriate and irresponsible use of antimicrobials. It is spread and it is exacerbated by inadequate water sanitation and hygiene in communities and poor infection prevention and control in healthcare facilities. And it is confounded by socioeconomic status, behaviors, as well as governance. And these are just some of the complexities of AMR in human health. Now, the Joint Programming Initiative on AMR has generated knowledge and innovation in therapeutics, in diagnostics, in surveillance, in transmission and evolution, and in interventions. It has progressed from basic science and clinical sciences to the behavioral sciences, social sciences, and implementation science. It has also progressed from the traditional research projects to research networks and think tanks. Diversity, equity, and inclusion has incrementally increased, as has capacity strengthening and our focus on emerging researchers. So I'd like to think that the JPIAMR has had an unequivocal research on investment, unequivocal return on investment. As you know, antimicrobial resistance is considered the quintessential One Health issue because it exists and it's transmitted within and between humans, animals, plants, and the environment. I think in the next 10 years, efforts should focus on triangulating transmission dynamics, directionality, and risk assessment at One Health interfaces to inform where interventions and strategies should be implemented and at which source they should be implemented. So research occurs across a continuum. We have at the beginning we have the proof of concept, which is really undertaken in very controlled laboratory settings or clinical trials. This then progresses to proof of implementation in real-world settings, and it ultimately results in sustainable scale-up and sustainability such that the research outputs and outcomes are integrated into policies, programs, practices, and systems. Most of the JPIAMR projects to date have been proof of concept. Most, not all, but most. I would really like for the JPIAMR Next 2.0 to consider developing a knowledge translation strategy or knowledge mobilization strategy, such that the outputs and the outcomes and the evidence that is generated is translated such that it can be adapted and adopted in different country contexts and differentially resourced settings.